Welcome back, athletic training preceptors. First, I want to say thank you for returning to these modules. As a preceptor myself, sometimes it's hard to juggle doing your job, educating students, safely taking care of patients, and all the added things that you already do. Is it making a difference? I want to tell you, you are making a difference. Thank you for what you do for our students, and thank you for coming back to this program. I'm here to help you make it that much better. Today, we're going to explore a major component of clinical education that can transform the way we prepare future athletic trainers. Imagine a world where every student graduates not just with knowledge, but with the confidence and the skills to make independent clinical decisions from day one of their real job. This isn't just a dream. We can actually do this through the power of progressive autonomy. So let's dive in and discover how we can revolutionize our approach to clinical education. Progressive autonomy is crucial for preparing practice-ready professionals. What it does is it helps our students develop confidence and independence while providing a safe space to learn from their mistakes. Now, the benefits of progressive autonomy are many. Increased student confidence, development of clinical decision-making skills, a sense of responsibility, readiness for that independent practice, and a development of their overall professional identity. Think about your professional identity. How did you arrive where you are as a professional? Do you think your preceptor had a role in that? As the old saying goes, if it sounds too good to be true, well, then it is too good to be true. Implementing progressive autonomy does not come without its challenges. And as preceptors, we face balancing student autonomy with patient safety. There are still healthcare providers trying to provide a high level of healthcare in a safe manner while balancing the opportunities for that student to learn and perform on their own. We need to be able to assess the student's readiness to progress, or do they need to take a step back? Do they need to regress? Lastly, we need to also be able to adapt our teaching styles to the learning styles of the individual students. We all have different styles of teaching. We all have different styles of learning. We need to find the match, and that can be a big challenge. Now, preparing to be a preceptor, well, that's a challenge in itself. Recent research shows many gaps in preceptor preparedness. Many of us just lack the formal training on implementing progressive autonomy. In fact, recent surveys point to little to no training reported by preceptors on preparing them for their role as a preceptor, which leaves us in a situation where we rely on our personal experiences and trial and error. But wouldn't blame this on the program. They have trouble filling spots of preceptors, which leaves limited time for us to do our training. So, as you can see, we've pointed to the importance and the benefits. Now, if we match those up with the gaps or the flaws in our preceptor preparedness, we ask then, what is the solution? How are we supposed to fix this? Well, that's where we come in with our proposal. We propose adapting the Zwisch scale for athletic training. So, what exactly is the Zwisch scale? Well, if you think about surgeons and you think about them operating on people, there has to be a level of autonomy and trust as we move into letting them do procedures on their own. The Zwisch scale is a 4-level model developed in 2013 for assessing operative autonomy in surgical residents. It's based on a concept of guided autonomy and has been widely adopted in surgical training programs due to its effectiveness in assessing progress and guiding teaching. A little bit about the versatility of the Swiss scale. It's been widely adopted in surgical training programs and even adapted for use in various surgical specialties and non surgical fields. But is it a good scale? Well, the Zwisch scale has been validated through multiple studies, showing high inter-rater reliability and construct validity. Its simplicity and effectiveness have led to its widespread adoption. Take a look at the Zwisch scale. Notice the 4 levels of supervision. Notice the resident, their role. Observe the attending and their role. Pause the video to further examine the Zwisch scale. Now, since you've seen it, you can see that this is an easy transition from surgeon to athletic training. But not only is it easy, it's structured. So what we're proposing here is adapting this scale for athletic training and maintaining the 4-level structure while aligning it with the CATIE Standard 15 on progressive autonomy. Okay, the modified Zwisch scale for athletic training would look something like this. Number 1, show and tell, where the preceptor demonstrates and explains while the student observes. Number 2, active help, where the student performs with significant help from the preceptor. Number 3, passive help, where the student leads and the preceptor provides minimal assistance. And finally, supervision only, where the student performs independently and the preceptor simply observes. We feel implementing this modified Zwisch scale would provide a common language for assessing student autonomy. It would also help us as preceptors gauge appropriate levels of involvement and facilitate the structured progression or regression of those students' responsibilities. Now, implementing this effectively, we'd need to train our preceptors, and that's where we are right now. We need to integrate this into existing assessment tools like those CIPs that we already use to grade those students. We'd also encourage you to take regular preceptor-student discussions through this scale as a reference to discuss if the student is ready to progress or regress. Now, with anything new comes challenges. And some of the challenges that we've identified with this scale are ensuring consistent application across different clinical settings. We're all not in high school rotations or college rotations or clinic rotations. We have different settings with different demands and different patients and different students. And let's face it, we get busy. That's just the real. But there is a huge opportunity here to help enhance our students' learning. Along with that, we have to balance that autonomy for that student with our patient safety. We want to give the most real application for that student, but we want to also give high-level, safe patient care. So as we look at these challenges, we also need to understand that there are potential benefits that are significant beyond measure. As we look ahead, we aim to validate this modified Zwisch scale for athletic training, and that's where you come in. We hope to develop specific guidelines for each autonomy level and create a comprehensive training module for all preceptors. By incorporating this modified Zwisch scale into our preceptor development program, we can provide a structured framework for implementing and assessing progressively autonomous experiences in athletic training clinical education. This approach aligns with the needs we've identified and it offers a practical tool for guiding student development. Thank you for your attention and your time and all you do for our students. Now, let's work together to elevate the standard of athletic training education and produce confident, competent professionals ready to excel in their careers.